and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Supervisor Locke with the invocation.
We seek your help with decisions tonight. Bless this meeting with your divine intelligence and help us to make the best use of our own. Thank you for being our source of guidance. Amen.
Amen. Supervisor Robel.
Thank you, Mr. Chairman. I'll move for the adoption of this evening's amended agenda.
It's been moved and seconded. All in favor signify by saying aye.
Aye.
Opposed? Carried. Is there anybody from the public that would like to speak on anything on the agenda this evening? Now is your chance to talk. Is there anybody from the public that would like to speak on anything on the agenda this evening? Okay, that portion of the meeting will be closed. Communications and petitions from the clerk.
We have a notice of claim coming from the Claim Center, and this is a investigation from a claim from AT&T, and this was received on October 4th and will be referred to the Personnel and Finance Committee. We have another notice of claim from Ann Hellman for damages. Her dog was injured when it was attacked by a sheriff's dog, and this has also been referred to the Personnel and Finance Committee. We have a petition for zoning amendment from Michael Jancy in the town of Wolf River, requesting a zoning change from agricultural to residential for an addition to their home, referred to Planning and Zoning. And another petition for zoning from Eric Polsky, town of Nakaimai, requesting a zoning change from P1A2 to B3 for small business and warehousing, referred to Planning and Zoning. That's all.
Okay. Reports from committees, commissions, and boards. Anybody? Supervisor Egan.
Thank you, Mr. Chairman. At this time, on behalf of the town of Rushford, the bridge is going to be open hopefully this next week over the Fox River there, and they're going to be holding party or ribbon cutting on Sunday, October 20th from 11 till 3. 1 o'clock will be the actual ribbon cutting. They are going to have the Mel Albright band there. They'll be selling refreshments, and all proceeds, the snowmobile club will be, and all proceeds will be going to a local children's establishment. So you're all more than welcome to come, and we look forward to having you all. 11 till 3 with 1 o'clock will be ribbon cutting with local dignitaries and state, hopefully, and also county officials speaking. Thank you.
Thank you. Supervisor Finch.
Thank you, Mr. Chairman. I just want to state that this past Saturday they had the opening of the Butamore Bridge, the paths for walking, trails, biking, actually fishing, the whole 9 yards. And they had the tribes were there to present their tribes and everything, and it was just a well structured event. And I want to personally thank Mark Harris for when he got up to acknowledge all the county board supervisors that was there. I thought that was very nice of him. Thank you.
Thank you. Supervisor Brennan.
Thank you, Mr. Chairman. I would like to announce that there will not be a legislative committee meeting this month. There are lack of agenda items is the issue, so there will not be a legislative committee meeting this month.
Okay, thank you. Supervisor Haig.
Thank you, Mr. Chairman. I just wanted to report briefly on the most recent Tri-County Rec Board meeting. As one of the two supervisors on this board who represents Winnebago County, I know that there's been some hunger from some members to hear more from that board. So just as a brief report from the September meeting, there is ice there, there is skating going on, and the 2014 budget was proposed. There is quite a hole in the budget from the youth hockey organization. There was another organization that dropped out and provided another small hole in revenue. They are optimistic, perhaps is a good word, and or hopeful for some of their other budget line items. And they are showing that at the end of the year, they should have pretty much an equalized revenue and program budget, so it should come out fairly evenly unless there's a sharp decline. They're hopeful that this being a Winter Olympic year, that there will be a renewed interest in skating. And if anybody wants a copy of the budget to see the specific line items, just get a hold of me and let me know. There were no minutes, so there were no minutes from the previous meeting, which I believe was June, to approve. Hopefully there will be minutes for the previous two meetings at our next committee meeting. So again, if anybody wants to see the budget going forward, give me a call or shoot me an email, and I'll make sure to get you a copy. Thank you.
Supervisor Robel, thank you.
Thank you, Mr. Chairman. I just wanted to, for the board's information, I attended a hearing up in the town of Menasha a couple of weeks ago on the 441 and 10 and 41 project, and they kind of assured that they would be starting next May, around the 14th of May they would be starting, and the project will start on 41 and the bridge. So it looks like everything is all set to go, and I just wanted the board to know that. Thank you.
Thank you. Supervisor Ellis.
Thank you, Mr. Chairman. I just want to know everybody to know on the Parkview quarterly Parkview Health Center newsletter and some of the good things that are happening at Parkview, and also draw your attention to some of the generous grants that we receive there. Thank you.
Thank you. Supervisor Barker.
Thank you, Mr. Chairman. I have two things I want to mention that's going to be going on in Menasha in the next couple weeks. And one is there's a program at the library on the 22nd, Tuesday the 22nd at 7 o'clock at night, which sounds very interesting. They have brought in someone who's a professional Ghostbuster type of person, and they claim that they have now made contact with Lucy Pleasance, who was the first librarian in the 1800s at the Menasha Library. So that sounds pretty good. And I don't know if anybody listened to me on the radio this morning. I did my program on what is haunted in the valley, but did not have enough time for the whole thing. So I will be giving the whole program also at the library. But on the 30th of this month, from 6:30 to 8:30, I'll be talking about what's haunted all through the valley, from all the way down here, from the Opera House down here, all the way through the farms in Winnebago County. So if anybody wants to come to either one, we'll be glad to and hope you enjoy our library.
Thank you. Supervisor Wingren.
Thank you, Mr. Chairman. I know we briefly touched on this before, but I recently received a publication from UW Oshkosh, and a copy of that has been placed in front of you, about our fellow supervisor and friend Bob Warnke. It's a remarkable achievement. When I was teaching junior high kids, the kids that were in leadership, I always told them that in order to succeed in life, there's a little thing, remember, it's got 10 words, and each word only has 2 letters. And it's, if it is to be, it is up to me. And Bob Warnke is just a wonderful role model for all of us, and I want him to know that I have always admired him, and I, if possible, can admire him even more. We're very proud of you, Bob.
approval of proceedings from September 3rd and 17th meetings. It's been moved and seconded. Are there any additions or corrections on either one? All in favor signify by saying aye for the 3rd and 17th. Opposed? Carried. County Executives Report.
I'd like to take this opportunity to point out to the board Resolution 276, 10-2013. It's a resolution regarding the administrative employees' pay schedules. I've also included in your packets a summary that shows the average pay increase nationally over the last several years. We've kind of lagged the national averages for several years now, and this year the proposal is pretty reasonable in light of the 2.9% average increase that's been suggested will be what employers will give in 2014. This will come in as an average significantly below that, but closer to it than we have been in prior years. And I think it's pretty important that we take care of that. The represented employees' pay increases won't be brought to the board until sometime early next year, because under current law we're not allowed to proceed with those until there's recertification taking place probably in January or February. And that's my report. I also have some appointments to present to the board.
Okay. Go ahead.
An appointment to the Grievance Review Board, subject to the board's approval, of Brenda Keller.
Been moved and seconded. All in favor signify by saying aye.
Aye. An
Opposed? Carried.
appointment to the Local Emergency Planning Commission of Emily Milkowski and Deborah Berner.
Been moved and seconded. All in favor signify by saying aye. Aye. Opposed? Carried.
Appointment to the Winnebago Library System Board of Trustees of Elizabeth M. Irish.
Been moved and seconded. All in favor signify by saying aye. Aye. Opposed? Carried.
Thank you.
Okay, I have a correction on, there was a correction on the date for, give it to me, so I had it in my pile. On the Emergency Planning Commission, it says December 31st, 2014. The correction was to be 2016.
Thank you.
Just the other way.
Just the other way around.
Yeah.
Okay, I would like your approval for appoint Shannon Gleason to the county board.
Second.
Been moved and seconded. All in favor signify by saying aye.
Aye.
Opposed? Carried. Okay, Shannon, I would like to have you come up. Pardon? Okay, would you raise your right hand and then repeat after me? I, Shannon Gilson,
I, Shannon Gilson,
have been appointed to the office
have been appointed to the office
of County Board Supervisor,
of County Board Supervisor,
District 16,
District 16.
swear that I will support the Constitution
I swear I will support the Constitution
of the United States
of the United States
and the Constitution of the State of Wisconsin,
and the Constitution of of Wisconsin,
and will faithfully and impartially
and will faithfully and impartially
discharge the duties
discharge the duties
of said office
of said office
to the best of my ability.
to the best of my ability.
So help me God.
So help me God.
Welcome aboard.
I
And I have a comment. And Mr. Warnke, as you tutored Mr. Warnke through college, he will now be tutoring you on the board. So, as he'll be showing you how to do everything here.
Yeah. We need to sign this oath. Okay.
Oh. At this time, I'd like to ask Mike Collier, the Human Resource Director, to come up, and him and Mr. Sage will be given a report on our health insurance.
Good evening. For those of you who don't know me, my name is Mike Collard. I'm your County Human Resources Director. With me tonight is Jan Stage from Associated Financial Group, who serves as our consultant broker for health insurance and employee benefit matters. So we're here tonight just to give you a little bit of an update on where we are with what is sometimes a controversial or difficult topic, but you'll hear we have some good news for you today, so I think it'll be a pleasant report. Next, please. Employee health insurance is, of course, one of the county's largest expenses in the entire county budget. It comes to about $12 million a year. So that's always one of my top priorities as the Human Resources Director, because I look at the bottom line and the potential costs and savings and expense that can result based on finding the very best value for our employees at the lowest cost to taxpayers. So it's a high priority item for all of us. Looking ahead to 2014 at what the premium expense might be, one thing I do is keep in pretty good touch with a lot of other personnel directors, and we're hearing increases projected for 2014. Some are projecting no increase, but most are closer to 10% and some as high as 20%. The city of Oshkosh is looking at a big bill for next year right now. If we were to see a 20% increase, that's more than $2 million added to the tax levy. So I'm here to tell you what we did to avoid that. To fully understand some of the things we did, I'll try not to bore you because you were here and I wasn't, but we have to just remind ourselves a little bit of where we were and what our current health plan design is for employees. There were a lot of changes made, big action taken, effective last October 1st, 2012. So at that time, before then, there were a total of 6 different health insurance plans. There were 3 in the self-funded group, 3 with network health plan, which had a majority, but only by about 2/3, 1/3 margin. And at that time, the board elected to restructure that health benefit, make some major changes. As a result of those changes, Network Health Plan became our only health vendor, our only health provider or insurer for the county employees. That was a big change. The self-funded plan, where the county was paying our own bills, kind of acting like our own insurance company, was eliminated, and everyone was moved into the fully insured Network Health Plan with Network as the insurer. Also made some changes to the structure of the plan, changed it to a calendar year basis, so instead of ending on October 1, we had a 15-month year, which will end the end of December 2013, of course. Among other changes, we established what's known as a health reimbursement account arrangement, so that the main plan, for instance, has a $1,500 single deductible, but with the first $750 of that deductible covered by a reimbursement account, so the employee could get that money back and really only face the second $750 of exposure for personal health expenses. As a result of all those changes, the county saved a lot of money. There's no denying that, compared to the plans that the county had previously. One number I saw at least was $1.3 million a year, and I'm confident it was at least in that range. Now, the plan we have right now is the result of those changes, and I'd say it's been going pretty well, but there are some areas of concern, some things we wanted to look at. Almost all of our employees, a large majority, are in what's called Plan 2 out of the 3 plans we have. The main reason, it's by far the cheapest plan for employees. Employees pay at least 10% of the premium for the cheapest plan. They have to pay the difference between that level and the cost of the premium in the other plans, which are higher premiums. If an employee doesn't take the health risk assessment program, that could be a base of 15% of the premium. So all of our employees pay at least 10 to 15% of the premium of the cheapest plan. Then if they want to take one of the other plans, they would have to pay the difference. The plan we have now is really just the network health plan network of providers. So Affinity Health Systems is, of course, the largest member of that. Some of the other local providers are in that. But there are two main issues with it. One is it doesn't cover Aurora in this area. And there's some other providers it doesn't cover, but mainly Aurora is the primary one people think about. And it doesn't have much of a geographic reach. Now, if you have a college-age son or daughter in Minnesota, there's no one out there in our network plan, although they do make arrangements to provide some coverage in that situation. It's awkward. Also, I've heard a lot of comments from employees who are not happy with the procedure for getting those reimbursements, because they go to the doctor, they kind of have to put the money up front and then collect the bill and fill out a form and submit it to our vendor for reimbursement and eventually get a check back, so there's a long delay in getting their money back, which obviously people don't like. We do still have 3 plans, but plans 1 and 3 currently have very few members. Plan 3 in particular is the one that still does include Aurora. It has the broader network, a point of service plan. However, it has very high deductibles in network and extremely high deductibles out of network. A higher premium, slightly higher, and employees in that plan don't get the health reimbursements. So the deductible is all the employee responsibility. As a result, we have only 2 people in that entire plan. It's obviously not really serving any function because it's cost prohibitive for employees. So that's something we wanted to think about. Plan 1, on the other hand, has about 56 people in it, but half of them are retirees, roughly. And Plan 1 has a different deductible structure. There are lower deductibles, but more co-pays, significantly higher premium, and no reimbursement accounts. Now, we planned, I think it was the beginning of the summer, about May or June, when we really started planning how to go about developing the health insurance plan for 2014. We really just finished that process today, I would say, in determining the final premium. At the start of the process, we wanted to consider all of our options, so we asked Jan to send out requests for proposals to all the major healthcare vendors. There's a list on the board. The 6 major vendors in this area, really, that are available to us. There are others that are smaller, but these are the main players, and we sent requests for proposals to all of them, keeping the ball game completely open, wanting to find the best deal we could on whatever terms we could, not sticking hard and fast to exactly what we had, although recognizing that having put employees through a huge change at the end of 2012, we weren't really looking to make a big change if we didn't need to, depending on the economics. We did get proposals from a majority of these vendors, and in particular the first 3. Network, our current insurer, the WEA Trust, that's the Wisconsin Education Association, or the Teachers Union Trust, and the Counties Association Group Health Trust. They all made us very good proposals at one point or another in the process, and sometimes more than once. The other 3 either didn't bid, or their bids, I know at least one of them bid, but just were not competitive. Didn't offer us anything any better than the others and at a higher cost. Now, in structuring the new health plan, trying to put it together what it's going to look like and what the money is going to look like, we had a more complicated situation to consider in one respect because of the Affordable Care Act legislation, Obamacare. There are 2 main areas that we had to look at, I would say. One is the rules of Obamacare itself and the various penalties and rules that would apply to us as the employer or sponsor of the health plan, and 2, the particular taxes or fees that are levied under that legislation. So just to give you an idea or a little flavor of some of the issues we went through, I actually have a book about a quarter-inch thick that Jan gave me, with analysis of all the detailed issues. But these are the biggest ones. Pay or play requirement, that is the part of Affordable Care Act that says an employer of a certain size really has to offer insurance to all of its employees that work more than 30 hours a week. We've all heard about that. We actually already have been offering health insurance to every employee who works 30 hours or more a week. In fact, we go down in most cases to 20 hours a week. So that wasn't directly a problem for us, but still something to think about because it might give us some options. In any event, that requirement was delayed to 2015. Something that was of, in fact, bigger concern to me was the affordability test. If we offer health insurance, fine, we miss, the main penalty, but we still could have a penalty if an employee had to pay too big a percentage of the premium, and it came out to more than 9.5% of household income, a complicated, not that complicated, but a formula that would be applied to determine whether that person could then go into the exchanges, get a subsidy, and if they were under that income level and still got a subsidy because our premiums were too high in terms of what we charged the employee, we would still have to pay a penalty. Not as big as for if we didn't offer health insurance at all, but something, and that was mainly going to affect certain of our part-time employees. Bulk of them are probably at Parkview. And of course, we've all heard about the Cadillac tax. Not a big concern for us this year in planning our renewal, but it is on the horizon. If our benefit structure gets too rich compared to the federal standard, there's a substantial penalty that would apply to us. Jan and his firm have done some projections that say we could run into that as early as 2018. So that's something we're going to be watching very carefully. Of course, between 2013 and 2018 and the lifespan of federal legislation could be several volumes full of regulations that could happen between now and then, so we'll see what happens. Okay. The other category was the fees imposed by Obamacare, and these come into the premium calculations. We had to decide how to deal with these. So the first one, the risk adjustment fee. Thank you for keeping up with me. I haven't even been saying next or anything. Just a couple $1,000s a year. It's $1 a year per covered member, including dependents, I believe, and that can be added to the premium. Relatively small potatoes. The patient-centered outcomes research fee is about twice that, and that's levied directly on us as the employer, even in 2013, and we can't pass it on to employees, so we have to be careful to segregate that from the premium. And then the two big ones come. First was the reinsurance fee, Affordable Care Act reinsurance fee. It's a percentage of our total premiums, about 1.4%, I believe, formula again, and it comes to about $140,000 a year projected for us next year. So we're starting to get into some significant money. And then the largest one is the insurer fee, $330,000 a year estimate, starting next year. And that gave us a lot to think about because if we went back to a completely self-funded plan, that would not be charged to us. Because it's not charged on self-funded plans. It's only charged on insurance policies. So again, back to our bidders list, we had the WEA Trust and the Group Health Trust. Those are both not pure insurance companies. They're trust arrangements, kind of a way of having a shared self-insurance risk pool, and therefore they're not charged that last fee, $330,000. If you had asked me back in May or June, I thought we were going to be headed to being self-funded because of that reason. But in any event, once we got the initial set of proposals from some of our vendors, we started to negotiate a little bit and look at what they were offering. Early on, the word from our current insurer, Network, was that we might be looking at a 12% increase. We might be able to haggle them down to 10, something like that. That just wasn't acceptable. We needed to get it down lower and provide better value to employees. So we started talking more seriously to some of the other vendors. And in fact, we got a very interesting proposal at first from WEA Trust, the teachers union people. And that kind of started getting a competitive situation going. And I've been doing negotiating for a lot of years, and that just lit up my eyes when I saw that kind of thing start to happen, because we soon got ourselves into a very favorable situation in terms of bargaining leverage, because the WEA Trust, frankly, really wanted to start selling health insurance to cities and counties. They actually started it last year, but they only have 6 or 8 cities and 1 county so far. So they really wanted to get into this market because they've lost some of their school district business, which is their core business. So we got into a real competitive situation. And then, of course, the Group Health Trusts say, we're the county's association people. We can't get beat out by the school district people. So they came in with a very attractive proposal, and then Network Health Plan really started sweating about the prospect of losing a major employer in the area, which they didn't want to do. So we really went through a couple rounds, I would say, of competitive bidding, and very open process. We were very fair to all the bidders, in that we weren't playing one off directly against the other. When we get a hint from one, we tell all of them, all right, we're doing another round, give us again your best bid. And we kept doing that essentially until we got near the end of September, when we really had to make a decision, and besides, no one was going to move any further. So at the end, all three bidders made in-person proposals to us, or had meetings with us to discuss the details. And at the end of the game, we had Network in our conference room making an extremely attractive proposal that we just had no reason to say no to. So we are going to be renewing with Network, but on better terms, better financial terms, and even better terms related to how the plan is structured. So I want to tell you a little bit about that. I know you heard last year, or a year and a half ago, I should say, probably from a lot of employees with the bad news about health insurance, and upset about the changes, and upset they couldn't go to Aurora. For 2014, we expect the changes are all going to be in the favorable direction for employees, and also the favorable direction for the county taxpayer. So it's really the proverbial win-win. With regard to the plans, Plan 3, we will still have a Plan 3, but it'll be very different from our current Plan 3, which has only the 2 members. So Plan 3 will be much more realistic. Plan 3 will be the statewide, nationwide provider type plan. So Aurora's included, and really everybody's included. Network has gone out and negotiated, hidden kind of network discount arrangements with various national and regional networks to provide us with the discount structure to get the best prices from the healthcare providers, but without imposing any penalty on employees based on where they go. Now that plan, we're able to offer employees with the same reimbursement, health reimbursement account arrangement that we have with our main plan now, which we can't currently offer, or don't currently offer. There is an extra cost to that, and I'm sure Network would have rather not made that available to us, because it lets some employees migrate away from Affinity and to Aurora or other providers of the employee's choice. So there is a higher cost to that, naturally, but we kept that cost fairly reasonable. It's about a 6% higher premium when you look at the total premium. And so we would offer that to employees, but just pass on that extra 6% to employees. So it doesn't cost us anything different whether the employee takes Plan 2 or Plan 3. So that's going to be a great option for employees who really want to go back to their Aurora doctors, or who have dependents out of state. By the way, I've got Aurora doctors and I've got dependents out of state, but that didn't affect the decision here. It's just another option, and it doesn't cost the county any extra dollars whatsoever. Plan 2 is still the main plan, and a large majority of employees will undoubtedly be in there. The reimbursement accounts, it'll be the same amount, the same deductible of $1,500 for a single plan, for instance, and the same reimbursement of half that amount. But instead of having to pay up front, get the bill, send the bill in to our vendor, EBC, and eventually getting the money back, Network Health Plan will send the bill directly to EBC. So the employee won't have to pay the bill unless it's something that's not covered, or unless it's something that's in excess of the amount they have in their reimbursement account. If they use it all up, then the employee has to start paying. So that'll make employees significantly happier with the plan, I'm confident. A few other goodies in here that I'm very happy with. There's a wellness plan provided, and I won't go into the details, but it's a plan where Network will provide direct incentives to employees for going online and participating in certain health-related activities and documenting that. It's a very common thing employers are doing these days. Often shows good results. They're improving our prescription benefit. There are certain drugs, frankly, where it's smart for the insurer to give you a better deal, because there's a wide difference in the price of drugs. And it's not just generic, brand name. There could be 2 brands. They're different drugs, but they do kind of the same thing. And the doctor could prescribe you this one that costs $50 or this one that costs $200. Okay? When the insurance company sees a few opportunities like that, they have a list of drugs where the employee can get the cheaper drug with no copay whatsoever. So provide some incentive for good cost control there. And something that I was very happy to see, our vendors started competing on what they would guarantee us for the next year. I want to assure you, we've made no commitment for 2015. It's a purely one-year deal for us, but from Network, we have a guarantee that their premiums will not be doubled in 2015 to make up for the money they're going to lose on us in 2014. In fact, there will be a maximum increase of 10%. So not an ideal situation if it goes up 10%, but if we don't like the 10% or whatever they come up with, we can always look elsewhere, negotiate, find a better vendor. Whatever the market will offer us at that time is still open to us. But we have that cap, so we know the budget won't be completely shot in 2015 no matter what happens. Plan 1 no longer makes any sense at all for our active employees because the only real advantage was the health reimbursement account situation, and we're planning on fixing that for next year. So Plan 1 would be eliminated for active employees. One exception to that is we have a number of retirees who are currently on Plan 1. It doesn't make sense to force them to move right now. We can keep them in Plan 1 for retirees because of the way the reimbursement accounts work. It's probably cheaper for us to keep them in Plan 1 anyway. But once the Affordable Care Act exchanges really get going and people understand what's out there and it's a less stressful situation for them, we definitely expect that we'll be making some other changes a year from now with respect to the retiree coverage anyway, because there should be much better opportunities for them. So that's what the plan will look like, and we think it's much better. So it's the final slide, last line, bottom line. What are the numbers? To our somewhat astonishment and definite delight, we're actually showing a negative premium change, actual cut in premiums. Small cut. I don't want to get too excited about it, but it's a lot better than having an increase. It's a 1% or so drop on average. So these are the actual premium numbers with the Obamacare taxes added into them. In fact, we really just finished calculating these numbers with Jan's help this afternoon because of the calculations and formulas we have to follow under Obamacare to build those in. So these are not the raw premiums from Network. They're the actual total cost of insuring a single or a double or a family member of our health plan. Of course, that's not the cost of the county either, because the cost of the county will be at most 90% of that, depending on what percentage the employee pays. And we're not planning on really changing anything about the percentages the employee pays. The retirees, for instance, still pay 100%. The county would pay at most 85 or 90% of the Plan 2 premiums, which are the ones on the wall here. And if the employee does pick Plan 3, the difference is on the employee. So that's where we are. We're very pleased to be able to offer that. We have planned a schedule of at least a dozen employee meetings in the next 3 weeks to explain this to employees, provide them with information they need to choose between Plan 2 and Plan 3, and otherwise just break them the good news, about the new options available to them. But here I'm breaking you the news that it's not going to break the budget. It's going to be a positive factor for us this year and at least some cost control for the year after. So, next slide.
Okay, is there any questions?
Questions. Questions for either me or Jan, our consultant, who I think has done an outstanding job working with us and giving this here.
Thank you, Mr. Chairman. Luckily, I did find your report from last year too, Jan, so we're right on board here. In regards to the Affordable Care Act, is it feasible or possible for Winnebago County to ask for a waiver? Well, it's my understanding that there's been a number of corporations and other entities. I don't know how many of those entities, if any, are government entities, but I know that there's a lot of speculation and talk that certain labor unions are going to ask for exemption or waivers under Obamacare. So is it feasible that Winnebago County should do so?
Not that I'm aware of. I'm not aware of any basis with which the county could do that. Now, of course, pay or play is delayed until 2015, so that's not impacting the county. And even though the fees are in play for 2014, which Mike talked about, the renewal really diminishes those. It's not having a financial impact on the county this year, at least an outright impact, because they're built into the fees offered by Network Health Plan.
Is it possible that you could investigate that? I mean, not some type of a long investigation, but I mean, is it possible you could at least ask the question to somebody who...
You bet.
I know that there's limited resources in regards to the Affordable Care Act right now too, but if there is somebody you could ask, if you would do so, I'd appreciate it.
Yeah, it's an easy ask for us, and I may have shared with you in the past, one of the services that Associated Financial Group brings to the table is we do have 6 attorneys on staff, and 2 of them I would consider experts on the Affordable Care Act. And I can get that answered tomorrow.
Okay, so that would make 2 we have in the country, right?
They're always very careful to say up front that this is what we know at this time.
Okay, so in regards to one of the last slides there where it showed a negative change for county employees as far as what they'll be paying into healthcare, what would the negative change be per employee without Obamacare?
That's a tough question to answer. And the reason why it's difficult to answer is because the fees are built into the fully insured rates offered by Network Health Plan. And the rates offered by Network Health Plan were a result of a bid process. And so that's tough to quantify. In giving you a number, Mike had some numbers listed on the screen. The insurer fee, if they're building it in, it's $330,000. The reinsurance fee is pretty straightforward. That's $5.25 per covered member per month, or $63 per year. That's built into there. And then the other, in effect, the other 2 fees, it's $3 per member covered. So all those are built in.
I think I asked that question based on your presentation from last year where you said that we could, as an impact of health care reform for January 1, we could, assuming no changes, which obviously there's been some changes, assume an added burden of approximately $850,000 for 2014.
Yep. And we redid a calculation earlier this year, and the financial impact built in for those 4 fees, the amount we came up with, $477,000.
Okay. And then the last question I have is in regards to 2018, with this potential with the Cadillac tax. The comment was made, if it gets too rich, and I don't know if there's been changes in either Plan 2 or Plan 3 that make it less rich, but my understanding was that as of 2018, regarding the Cadillac tax, there would be an impact of about $3.35 million to the county. Is that still basing on the current Plan 2 and Plan 3 structure? Is that about what we're looking at in regards to the Affordable Care Act Cadillac tax?
We redid the calculation for that as well. And the number that we're coming up today, looking at the plans as they are today and assuming no change, and then also assuming a trend of about 10%, we're estimating that if nothing changes, trends impacts, we're looking at $387,000. Now, it is a little bit unrealistic because we're using a 10% trend. Employers, whether it's public like the county or private, simply can't afford that. And so if it's larger than what can be afforded, they're probably going to make changes to reduce that percent of increase. And so that'll have an impact too. But right now we're assuming with those assumptions in place, we're looking at $387,000.
And then the last question is, did you refigure what the county would pay if we eliminated health care and just paid the tax?
Yes. I'm glad I brought this. If the county were to, and this takes into consideration more than just the penalty. So we're assuming that if the county were to discontinue offering health insurance, they'd have to offer something to employees to hire employees and to maintain employment. So just the penalties alone would be about $2 million doing that. And then if you were to pay some employees, and we used an estimate of $1,000 per month after tax money to pay employees in lieu of health insurance. And right now the average cost the county pays is higher than that. And so if we throw that in, that's about $12 million there. And so you add those two costs, we're coming up to over close to $14 million to not offer health insurance. Now, the money in lieu of is not required. Right. That's totally discretionary on the employer's part, and you don't have to do that.
Thank you.
Supervisor Eisen.
Thank you, Mr. Chairman. I'm very impressed by how things have progressed in the last 7 years. In 2012, we were on track for a $16 million medical insurance premium, and to see how things have mellowed out, even with the health care reform. I see that in the county executive's budget, there's $405,050 is the amount that is listed as the expense for the forthcoming year. Is that the same as what the premium is going to be, or are your calculations less than that? Will we see a change in the original? Was the budget including this final negotiation, the selection of the company, and all the advances we've had in negotiations? What is the premium? We see what they are for each individual, but what does that calculate out to, please?
I don't have the exact number with me. I think Chuck showed it to me once, and it was something like 12 million. I want to say 12,065,000. I don't have that number with me because I'm working more on the per employee side of things myself.
I don't have it with me.
Yeah.
And I would just point out that remember how the plan is set up. So you have the health insurance premiums that pay for the health plan. There's also the health reimbursement account.
Correct.
That the county funds.
Now, health reimbursement is in addition to the premiums?
It is. And that is picked up by the county.
Okay. How much is the health reimbursement on top of the $12 million? $750 per family?
There's a separate line for that now that we established just for the 2014 budget. It wasn't really separately budgeted in 2013, but we set that up as part of the employee benefits budget for 2014. So there's a number in there, and again, I'm just going by memory.
Well, how many lives do we insure in the plan?
It's about 940 members, and it's a little 2,100 lives. Yeah. Well, I want to say 180,000 was the budget established. Of course, not all the reimbursements are used. They don't roll over from year to year. So we looked at historically what percentage have been used and applied that percentage to the total.
The reimbursements are not carried over.
Correct.
It's a use it or lose it type of a situation.
Yes, each year.
Only relates to medical expenses, doesn't apply to drugs?
It's any covered plan expense only. So the prescriptions are included in the plan, but things that are not covered by our health plan, such as vision or dental or over-the-counter medications, are not covered.
The health reimbursement only applies to the medical, not to the prescriptions?
No, it applies to medical and prescriptions that are covered by our plan.
Okay, so that any prescriptions that an employee purchases can be reimbursed through the reimbursement process?
For the employee share of the prescriptions. The employee has a copay.
The copay
so just,
of what
just
they
for the
have.
copay.
Okay. Now, for 2013, our adopted budget was $13,627,121. That's what we had in the adopted budget. How close are we on track to achieve that expense or that projected expense, or have we exceeded it, or are we behind it? We don't have to worry about the fluctuations in the self-insured plan because we have a fixed premium. How well are we on track now that we have 3 quarters behind us? I imagine you don't have this last quarter's statistics, but how are we perhaps at the halfway point?
3 quarters. Well, since we pay based on a premium, it's not like the self-funded plan where we track it month to month, except the dental plan we do that on. So we're on track.
We do pay a premium every month, don't we?
Yes.
How much did we pay them this year?
I don't have that number at my fingertips. We can certainly
check.
Okay. Another factor, too, in the 2013 budget is that when we ended the self-funded plan for 2012, we had a runoff of claims that ran over to 2013. From the budget document, that appears to be a $2,675,000 figure, if I'm reading it right. My question is, how are we paying for that $2.675 million? Is that included into the premium that we're speaking about, or is that coming out of the general fund?
Not the general fund, if I may. It's the self-insured insurance plan had its own fund or sub-fund that was an internal service fund at the county. And so the money was kept in that fund on a rollover basis. So there was, I know it was in excess of $2 million in that fund left when that plan ended. So the balance in that segregated fund was used to pay the runout and all the runout claims. In fact, we paid one, I think, about 2 weeks ago, which may be the last one.
Okay.
They're just about done now. There is still some money left in that account. We had plenty to pay all the claims. There's an excess left in there. I wanted to hang on to it because I thought we might be going back to self-funded.
Okay.
Now that looks less likely over the next 2 years, but again, in the future, there may be real
Well,
advantages
about
to going
approximately how
self-funded.
much is that left over?
I believe it was in excess of $1 million and maybe $2 million, but I'm really not sure.
Okay, so we have a $2 million excess money left over in the health insurance self-insured fund that hasn't been used to pay out. Well, we've got another $2 million cushion on our budget coming up this year. I think that's enough. Thank you.
Supervisor Brennan.
Thank you, Mr. Chairman. I guess I have a question and probably an observation that I would like to share. In regards to network and their capping the 2015 premium to 10%, is there anything stating in the contract that they do their number crunching and do their actuarials and figure out that they need a 25% increase in order to break even? Is there anything stopping them from walking away?
No, there's not.
Okay.
I'll partially disagree. There's a tremendous amount of business reputation at stake if they walk away. I know a lot of other personnel directors, and if they renege, it will be widely known. And just like any other business, you have to keep your reputation.
Well, I'd also point out that if you're not in business, you're not in business. And with that said, I guess what I'd state here is I'm a little tempered with the good news that we received tonight, because I'd like to point out that we were very fortunate to have a very aggressive suitor that really, really, really wanted our business. And I think that we should realize that because of that, we did get a negative number. This is what I'd call an anomaly. This is not going to continue. And we may pay the price down the road for this one-time, inexpensive year of insurance on several layers. Okay? So it's good news for this year. However, there may be a price to pay down the road when this gets farther down. So it's good news, however. Thank you.
Supervisor Turner.
My question has been answered, Mr. Chairman.
Supervisor Gabbard.
I have a simplistic question and then just some information to just share with the board. When you had the single, the double, and the family, and the premiums, do you have any age categories for a single county employer like there is in the private sector, which I'm one of, where in an age group your premium goes up according to certain age groups? So was that just an average, or was that what I don't understand this, so that's why I'm asking. In the county, when you quote a single and a double, is that for a 25-year-old employee and a 55-year-old employer, or do you have age brackets as there are in the private sector?
No, we don't have age brackets. For an active employee, we just rate the group as a whole, and the premium is for every active employee who has a single plan.
Okay, and then this is kind of on the order of Supervisor Brennan's. Just as an example, where I work, we had quotes for insurance last year, and we had 6 quotes, very similar to what you gentlemen got, and we had someone that came in very low, so we switched. And this year the renewal came back, and it was 36% higher from that same vendor, and they walked away from it. So we went with someone else. So I think that the trend in the private is that, yes, they will all bid, and yes, they will be competitive, and someone always lowballs it, and the next year you get hit. The other ones came back and told us, we told you that last year that they were going to do that to you. So 36% is a big hit. We went out and rebid it again and only got an 18% increase. So it can happen. Thanks.
I can top almost any story about price increases because, if you'll bear with me, my first county job was with Adams County, and I got there in June of 1998, and we had just the previous year switched to Blue Cross, or the county had. And so not long after I started looking for a renewal quote for health insurance for the next year, and there was some delay, and I eventually got one. It was 98.6% increase. They had totally undersold the business to get in, and then wanted to double the premiums, and of course we had terrible problems getting data and everything else. So I've been burned, and so I'm very sensitive to that possibility. That's why I like having some cap. It's better than nothing, although I fully appreciate Supervisor Brennan's comments that it's not going to last, and we may end up needing that $2 million in that fund to subsidize the expenses we run into later, but we'll hold out as long as we can.
Okay, I enjoyed your presentation, and I'm glad that we have the savings. My only concern is a year ago in our local newspaper that our school board got away from WEA Trust because somebody saved $2 million by going to another vendor. And I guess it's kind of the same story with these people. I'm concerned about, are they going to jack us halfway through this? You said there's no way that they can. I guess I have a concern for that, just for the fact that it looks like they're trying to get back in the game, but yet somebody outdid them by $2 million, you know what I mean, in our community, and they saved $2 million. Well, now they're back in lowering their stuff to get back in on the floor again. I guess I have concerns about that also, but I think that's great that you're saving us money. It was a good presentation. Thank you. There will not be a presentation on the Homeland Security Grant, so we'll go to zoning reports and ordinances. Report number 1, Paul Kinnear, Town of Nakaimai. Supervisor Brennan.
Thank you, Mr. Chairman. I would move for the acceptance of report number 1.
Been moved and seconded to accept report number 1. All in favor signify by saying aye.
Aye.
Opposed? Carried.
I would move for the adoption of mandatory ordinance number 1.
Been moved and seconded for mandatory ordinance number 1. All in favor signify by saying aye.
Aye.
Opposed? Carried. Resolution number 26992-013, disallow claim of Peter J. Long. Date of incident, July 24th, 2012, October 31st, 2012. Supervisor Rule.
Thank you, Mr. Chairman. I would move for the approval of resolution number 26992-013.
Been moved and seconded. All in favor signify by saying aye.
Aye.
Opposed? Carried. But you want to make a note because of all the correspondence that was a unanimous vote, or however you want to do it. Resolution number 270-10-2013, appropriate $70,000 for design and engineering to replace a 4-culvert water crossing on County Highway N in the town of Nakaimai. Supervisor Robel.
Yeah, thank you, Mr. Chairman. I'll move for the approval of Resolution 270-102013.
Been moved and seconded. Supervisor Fari.
Thank you, Mr. Chairman. If Mr. Winters is here, I'd like to ask him a couple questions, if I might. In the second whereas, we're talking about currently having 4 48-inch metal pipes, which are culverts. My question is, if it were feasible to go to a bridge structure as opposed to replacing the culverts, what is the cost difference? I could phrase it another way. What does it cost to replace the culverts, and what would it cost to install a bridge?
Replacing the 4 existing pipes in probably the same size or larger would be less expensive than a full-blown bridge structure. But one of the issues with the existing structure is it's no longer sized appropriately. We're seeing more flows. It can't accommodate. So 4 pipes matching the pipes there now wouldn't serve the purpose. But pipes would be less than a bridge in all likelihood.
Are we looking at some cost sharing from the federal government? I believe that's mentioned.
We're going to apply for bridge funding after we have it designed for construction. Yes.
Would that bridge funding, if that was approved, would that lower it down to the culvert cost? I mean, is there something close there?
In all likelihood, it would be less than the culvert cost. It's an 80-20 cost share on those projects typically.
Mm-hmm.
There's no guarantee we'll get it, but we'll apply for it.
Are you optimistic?
I'm optimistic we'll get it.
Okay, thank you.
Okay, we'll vote by a little pad. Aye if you approve, no if you disapprove. That is passed. Resolution 271-10-2013, authorize the transfer of $25,000 from the general fund undesignated fund balance to the capital project fund for the purpose of paying preliminary costs to mitigate flooding at the community park and Parkview Health Center. Supervisor Hamlin.
Thank you, Mr. Chairman. I would move for the resolution number 271-102013.
It's been moved and seconded. Supervisor Hardy.
Thank you, Chairman. I just have a question regarding the whereas on line 12 of this resolution, where it reads, whereas some of the problem is the result of commercial and residential development in the area. I'm wondering if the county currently has standards whereby commercial development and residential development needs to have flood mitigation plans the way they do, say, in the city of Oshkosh. I'm not sure who to address that to.
Mike, you want to try to answer it? Mr. Elder from the facilities director will.
This whole area is in the city of Oshkosh, so it is under the regulations of the stormwater utility for the city.
Okay, do we know if the commercial and residential development in this area complied with city requirements for flood mitigation control?
No, I don't.
Okay, thank you.
Supervisor Olson.
My question's been answered, thank you.
Supervisor Haig.
Thank you, Mr. Chairman. In regards to the Facilities and Property Management Committee vote 3-1, if I could just have a brief explanation of who voted against it and why. Thank you.
Supervisor Fari.
Thank you. I voted against this for multiple reasons. Let's start with the issue of mitigate flooding in the community park. We just approved $2 million expenditure for the improvements to that park. I felt that should be part of their responsibility under that $2 million to make that mitigation determination. The other issue is, one of the issues at Parkview Health Center is a backflow problem, creating some flooding issues. I totally understand that, but I think that should be addressed separately and corrected separately. The other concern I have is if we do this and if there's expansion at Parkview Health Center, once again referring to the city of Oshkosh requirements, we're going to get ourselves into a position where we're going to have to mitigate that stormwater, could be retention ponds, etc. So given all of that scenario, I thought it was inappropriate to support this.
Okay. Okay, we'll vote by machine. I also have a map here from Mr. Elder that the highway commissioner had given us, where somebody right across the street's looking to drain 40 more acres. So it's going to only get worse. So you can give this to who's ever doing their plan that there's more water coming. We'll vote by our little pad. Vote aye if you approve, no if you disapprove. Passed. Resolution 272-10-2013, authorize the Sheriff's Department to accept the $10,000 Department of Military Affairs grant and appropriate the funds to small equipment account of the Sheriff's Department 2013 budget for the purpose of purchasing SWAT team equipment. Supervisor Wingren.
Thank you, Mr. Chairman. I move approval of Resolution 272-10-2013.
Moved and seconded. All in favor signify by saying aye. Aye. Opposed? Carried. Resolution 273-10-2013, appropriate $31,000 to the airport capital outlay account to replace a failing boiler to be funded by the airport fund balance. Supervisor Wernke.
I move for your approval of 273-102013.
Been moved and seconded. All in favor signify by saying aye. Aye. Opposed? Carried. Resolution 274-10-2013, authorize the execution of an airport hangar lease between Whitman Regional Airport and Tim Johnson and Tracy Nowak. Supervisor Wernke.
I move for your approval of 274-1023-2013.
It's been moved and seconded. All in favor signify by saying aye. Aye. Opposed? Carried. Resolution 275-10-2013, disallow claim of Creeley Camp Trucking, incident date August 26, 2013. Supervisor Rule.
Thank you, Mr. Chairman. I would move for approval of resolution number 275-102013.
It's been moved and seconded. I just have a question for all you insurance wizards. Isn't there some way you can make him turn some of this into his insurance company and come back to us? Or how does that work? I mean, every day we have a claim for them.
Yeah.
Okay, I mean...
Generally, we have to have our insurer reject it for our insurer to get a chance to take a look at it and then say this is covered or not covered, and if it's not covered, then they can submit it into their company. However, we've had that conversation at our last solid waste board meeting that I made the statement that we are not that company's maintenance policy and that something needs to be a little bit more scrutinized on our end.
Okay, thank you. All in favor signify by saying aye. Aye. Opposed? Carried. Resolution 276-10-2013, adopt revisions to Winnebago County Administrative Salary Schedule. Supervisor Rowe.
Thank you, Mr. Chairman. I would move for the approval of resolution number 276-102013.
Been moved and seconded. Supervisor Fari.
Thank you, Mr. Chairman. It seems to be I'm dominating the floor tonight. I'd like to state publicly that when I received this amended and last-minute notice here, that resolution, that I was definitely going to vote against this because our represented employees got a 1% increase, and this is advocating 3.25. And I always look for some equality as we compensate our employees. However, I've been told that after the first of the year, apparently these contracts are coming up and that there will be a perception of and direction to equalize these increases. So based on those comments, which I trust and ensure are going to be accurate, I am going to support this, but I needed to say that publicly. Thank you for your time.
Supervisor Haig.
Thank you, Mr. Chairman. In regards to our Executive Harris' comments about employers to raise work pay by 2.9% next year, that was an article from July of this year, long before we're into the third week of a partial government shutdown. There is a rather large Wall Street bubble looming. There are a number of Winnebago County citizens, taxpayers, who are being laid off and who will continue to be laid off, who will not be assuming anything near a 2.9% pay increase next year. So I just hope that as a board, we are mindful of the taxpayers of the county, that it ain't everybody, and it might be far fewer people employed next year, much less have a 2.9% increase in their pay. Thank you.
Thank you. Supervisor Turner.
Thank you, Mr. Chairman. I'm kind of concerned here, too, that the non-representative employees are getting a higher pay raise than the representative employees. I mean, if you want to have disgruntled employees, the people that actually do the work, do a lot of the work, most of the work down here, are the representative employees. And when they see that they're not getting, the same the raises as their higher echelon or their bosses or anything like that, they get disgruntled. I mean, real easily, you know. So I don't think that I can vote for this tonight because I think like you should level the playing field. The 1.75 across the board. Now that is for all the employees, correct? For all the employees starting next year. Why didn't we just give the non-representative people the 1% too, as well as the representative people? I mean, I just don't understand this.
Mike, you want to explain it?
I'd like just to address the comparability of the union and non-union pay packages or pay increases that we've been giving. And there are two distinctions we need to make. First, we need to distinguish which year we're talking about. So the 1% that was not too long ago approved for most of our union groups was for 2013. And so what we've been doing is looking at, for each year, the comparison, adding together both the across-the-board increase, which is kind of the base, plus the step or additional increases that are given to certain employees, and averaging that out over the group, and then figuring the total average, then comparing those. So if we look just at 2013, which is not what the resolution before you is about, of course, but if we look at 2013, we had an across-the-board of 1% for everybody, union and non-union. Union people got their step increases as provided by their contracts, or are still getting those. Some of those are 4%. A lot of them are none because they're already at the maximum step. When we averaged it all out, it was just a little less than 1%, about 0.9% averaged across the whole union population. So that 1.9 for the unions was just a little bit higher than the 1.75 equivalent for non-unions, which was the 1% base plus the 1.5% given to people below the midpoint, came to an average of 1.75. It's tilted a little bit toward the union, but in part because it's more elegant to make the 1% across the board equal as well. So that was part of another factor that came into it. But now we're looking at 2014, and we have not determined the wage rates or any wage increases for 2014 for any of the union groups. That has to be negotiated, or at least it has to be negotiated with any of the unions that file petitions to recertify next January. So we can't even know which ones are going to do that for several more months. If they do recertify, we will negotiate with them, and the maximum increase available under Act 10, based on the CPI calculations that the state does every year, is 1.66%. So if you were to take that 1.66% and compare it to the 1.75%, it's fairly close, and it's tilted, again, in such a way that it will partially cancel out, the extra step increases that the union people get, and actually we expect come extremely close to making the union and non-union pay increases on an overall basis almost exactly the same.
Okay, thank you. 7 years ago, we mistreated 700 or 200 employees. We froze their step increases, froze their wages. These people were mistreated, and I was part of it. I thought we were going to go across the board and do it, and we never did. We never dealt with the representative. So these other people for 7 years sat. This is just a very small part that these people deserve because they were mistreated for 7 years, and I played a role in it. And I am the champion of them, as I'm accused, because of that reason. Supervisor Widener.
Thank you, Mr. Chairman. I just have a question. On line 27, it says if they have not reached their control point or their midpoint, does that say that a person can never get past that, or is that just, or the second question would be, if you're past that, you get no increase?
Mike?
Well, it's partially true. Now there's no real mechanism for moving past the control point or the midpoint, and that's been true since 2005. We haven't had a way to move past the midpoint. On the other hand, if you're past the midpoint already or past the control point, you'll still get the base increase. So under this resolution, you get the 1.75%. You just won't get the extra 1.5%. So some people will get the 1.75%, some will get the 3.25%, so the average increase comes to about 2.25%.
Thank you.
That's what I was referring to. Supervisor Lautenschlager.
Thank you, Mr. Chair. Mike, I get on line 22,
line 21. Amended so that the increase of wages of covered employees having continuing satisfactory job performance by 1.75%. I mean, I guess the question I have is, what is satisfactory job performance? If I have a little blemish or whatever, I won't get to the 1.75? I mean, I just don't.
No, not at all. It's quite rare. In fact, there maybe are a couple of employees a year who don't get it, and it's only an employee who's really on a performance improvement plan, kind of demonstrated not, a lack of ability to do the person's job, someone who's really on the bubble. It just is a way of giving, the supervisor a tool to say, we're going to delay your raise until you prove you can do the job, but it's very few employees that will affect.
All right, thank you.
Supervisor Hardy.
Thank you, Chairman. I'm a state employee. I haven't seen a raise in 5 years. I hear that's going to change this year. I'm very excited about that. I believe that anytime you increase the wages and salaries of the employees living in your county and in your local area, that money goes right back into the economy of Winnebago County, so I will vote in favor of this. Thank you.
Supervisor Farley.
Thank you. Just as a follow-up to the discussion, it's mentioned about this step issue and that. I'm kind of wondering, do we have a number of employees that are just going to get to 1.75 in comparison to the number of employees that are going to get to 3.25? Is that 50-50 approximately, or 60-40? Somebody have a idea?
It's approximately 50-50. I think it's slightly weighted toward people who are already at or above the midpoint. So a little less than half will get the higher amount.
Thank you.
Supervisor Olson.
Thank you, Mr. Chairman. I just have a quick procedural question. Why is this coming forward to us tonight when it's part of the proposed budget?
Mike, he wants to know, why is this coming to you tonight?
Well, it's my understanding that has been the board's practice for many years, is they want to establish that by a separate resolution so that we know that's the correct amount to include in the budget. Okay. So I think that's the...
Thank you.
Okay, we'll vote by our little iPad. Vote aye if you approve, no if you disapprove. Nothing happening. You have to push the button under there? You have to push the button under there. All in favor signify by saying aye. Aye. Opposed? 2 nays. Raise your hand, the nays. 2. Supervisor Robel.
Thank you, Mr. Chairman. I'll move that we adjourn until October 28th. That's on a Monday night, and it'll be our first budget meeting at 6 p.m.
Okay, I just wanted to report I may not be here on the 28th. I'm supposed to accept an award for the service for the county in our community here, so Mr. Brennan might be taking over. So, okay, we are adjourned.